Dear colleagues, let me introduce my PhD topic, which is about the teledentistry tools in the diagnosis of oral lesions. I am from the Department of Community Dentistry, and as my vision, I would like to establish a teledentistry application that could help in the differential diagnosis of oral lesions, and also it could make a personalized oral healthcare prevention program for different kind of oral diseases. As my mission, I would like to promote the role of teledentistry in the diagnosis and also in the prevention in the primary dental care and also in the community dental care. To achieve this mission, I have this following two specific goals. The first one is a meta-analysis, which is about the accuracy of teledentistry in the differential diagnosis of oral lesions. There was a huge change due to the COVID-19 during the last 1.5 years, and there were so many restrictions and changes in the healthcare that couldn't be solved without telemedicine help. For example, the triaging, e-check-in, or the documentation could benefit from telemedicine solutions. The prevalence of oral cancer is rising nowadays. The main risk factors are the following. For example, alcohol consumption, use of cigarettes, and also tobacco chewing, which is really common in the Far East, for example, in India and Malaysia. As in Hungary, you can see the patient turnover in the Department of Community Dentistry during the pandemic. It could cause several problems, not only in the diagnosis of oral lesion, but also the treatment and the follow-up, because only the urgent cases were treated for some months. Teleconsultations could be beneficial in the dental care as well. For example, in this research in Brazil, it showed that it could be a decent possibility or alternative for the face-to-face visits. All this information points to the fact that teledentistry could be used nowadays. To conclude, my aim is to investigate the opportunities of teledentistry according to the diagnosis of oral lesions, not only to help access to care, but also to stop the spread of COVID-19 and to have a remote diagnosis for any kind of oral lesions and to stop the manifestation to oral cancer. My clinical question is the following. Is it possible to use teledentistry tools for diagnosing oral lesions? The clinical implication is primarily based on the oral lesions, so the diagnosis is pretty easy. The treatment is non-surgical, and the specialists that are involved in the treatment and in the diagnosis are oral medicine specialists, or even primary dental care dentists can diagnose. However, if it is after manifestation and it becomes oral cancer, then all three are limited. The diagnosis is really hard, and it needs special extra imaging, for example. The treatment is every time surgical, and the specialists are maxillofacial surgeons, and also an onco team has to be involved. I made my systematic search in the following three databases, and I have 15 eligible full-text articles. I am right now in the part of data extraction. My second topic is about the effect of oral healthcare prevention program for post-stroke inpatient oral hygiene. Over 1 billion people live all around the world with any kind of disabilities nowadays, and unfortunately there is not a worldwide protocol for their prevention, their dental prevention during their rehabilitation. As in the dental team, they are not well prepared for special needs patients in any kind of facilities, and nor the nurses are trained for the maintenance of acceptable oral hygiene during their rehabilitation. To promote oral healthcare and dental rehabilitation in the PMNR, and also to include a personalized healthcare prevention program for the post-stroke rehabilitation. My clinical question is that, is there a significant difference in oral health status in post-stroke patients if they receive oral healthcare prevention program? And the clinical implication for this study is the following. Post-stroke patients are suffering from different kind of plegia that can cause a problem in the toothbrushing. And also the nurses are not well prepared for their acceptable oral healthcare maintenance. So as a result, tooth loss can cause several problems, for example, in eating, talking, or psychosocial consequences. Also, after their rehabilitation, a complex dental care is needed for them because they can have several problems after the rehabilitation. To prevent this miscarriage, I would recommend a personalized oral healthcare prevention program. I made my systematic search on the following 3 databases. And to end my presentation, I would like to give this quote: "A progress is impossible without a change, and those who cannot change their minds cannot change anything." Thank you for your attention.
Very nice projects, thank you. Now, your first core and kappa was 0.49. Okay, so
yeah, 47, but 43. Yes.
Well, it is my benign attitude, you know. I saw it as 43, in fact. Yeah. Okay, so what will you do when the reviewers will ask you to make a comment on this? So what will be your explanation?
With my co-investigator, we had some difficulties and also misunderstanding during the selection, but a third reviewer could see also our disagreements. So that's why the number of eligible articles became 32. So there was a third reviewer who could review all of our selected articles. But after we could consult with my co-investigator, so our next Cohen's kappa was better.
Have you investigated any factors that would influence the diagnosis of the taken photos or diagnosis from a photo? Are there any factors, for example,
the resolution of the photos? Well, yes, there are several studies that are investigating the resolution, and also they try to investigate the difference between different kind of cameras that are taking oral lesions. The photos of oral lesions. However, I would like to concentrate on primarily on the diagnosis of the lesions, and secondarily, it has any malignancy potential, because in my opinion, this is much more important in the clinics.
Okay, thank you.